we're going to continue this menopause series. Actually, this menopause series, I have one more topic next week, and after that I'm going to have a whole long series on endometriosis. Okay, endometriosis has always been a topic that is much passionate. I'm very passionate about endometriosis. Partly it's because I have endometriosis myself, and time and again I realized that a lot of women are suffering because of endometriosis. Partly it's because of lack of knowledge, not knowing what they need to do, and that's why I wish to share. And I will be having a whole long list of a whole series on endometriosis. Previously, I have already talked about endometriosis in my other live videos, but that is like one video talk everything about endometriosis A to Z, not in too much depth. So next week onwards, we'll be doing a full series of endometriosis. Today, I'm going to continue on menopause, and I'm going to talk about prolapse and incontinence. Actually, prolapse and incontinence, whether menopause or not, it can also happen. But why I put it under menopause? Because it's more common during menopause. Okay, so because it's more common, so that's why I decided to talk more about it during this menopause series. Okay. So it's not necessarily related to menopause. It can happen to anyone, even before when you're young. Some young girls also get incontinence, or after childbirth, which is very common. The last round I talked about prolapse and incontinence. I talk about after childbirth, which is in my YouTube channel. If you have not seen this video, you can go to my YouTube channel, Dr. Tan City Clinic, in the link that I have posted up in this post, and go to the YouTube channel and look for uterus prolapse and incontinence after childbirth. So now I'm going to be more specific towards menopause. Towards menopause is slightly different. So that's what I'm going to talk today. So why is it related to menopause? Because of our hormonal changes. So when the hormone become less, when the hormone goes away, when you menopause, you lack the hormone we call estrogen and progesterone. Without these two hormones in your body, there is a problem. Everything become lax, and then that is why it tend to cause problem. Because urine incontinence, if you look back at my video on urine incontinence, there's so many types of urine incontinence. But for menopause, the one that got worse after menopause is stress incontinence. What is stress incontinence? Stress incontinence is when you sneeze, achoo, you leak urine. When you cough, you leak urine. This is urine incontinence. So stress urine incontinence. The incontinence comes with stress. So it's not stress as in work stress or what's that. No, it is physical stress like coughing, like sneezing, or even running, jumping. Then you leak urine. So this is stress urine incontinence. And when you age, stress urine incontinence happens because there is laxity. It becomes lax. All the muscle around the urine tract lax already, become relaxed, so very loose, and then as a result, they cannot hold the urine because the outlet of the urine, there is actually like a sphincter. Sphincter, we say, is like a something that squeeze on so that it makes sure that the urine don't go out. But after you menopause, without all the hormones, it tends to relax, and that is why urine tend to leak out easily. So for stress incontinence, we always say that the treatment to it is only two things. One is Kegel exercise, two is surgery. So when you are younger, we always teach you Kegel. After delivery, you got stress incontinence, we always teach you Kegel. Even when you menopause, when you start having this urine incontinence, we also teach you Kegel. And all this incontinence don't actually need to wait until you really menopause. Actually, around 40s towards your menopause, it will already start. And we again teach you Kegel. So what is the difference between you learning Kegel at the age of 40, 50 compared to you learning Kegel at the age of 20, 30 when you give birth? There's no difference. But there is one difference when you start learning Kegel when you're 60, 70 or 80. So it can be a problem when you are a lot older. It's not easy to learn Kegel if you are like 70 or 80. It is not going to be easy because a lot of people after the menopause, as they grow older, they actually lose a lot of muscle bulk in their body. Because Kegel is about developing the muscles around the outlet of the bladder, the urine outlet. We want to develop the muscle. You know, it's like you do exercise to build muscle, right? You lift weights, then you get muscle here, right? So if you do Kegel, the muscles around the outlet of the urine will be built up and become bulky, and that is how it can hold the urine. But for somebody who is in their 70s and 80s, they tend to lose muscle. As you grow older, you lose muscle, and as a result, you may not be able to do Kegel so effectively anymore, especially if you have not been doing Kegel all along. You never use Kegel all along, only when you are in your 70s, then you want to do Kegel. It's not going to be so easy anymore. And why we want women to do this is also because urine incontinence can be a problem. You know, a lot of old people wear Pampers, right? I'm sure you know a lot of old people wear Pampers, and that's what we don't want. And the other reason why they have more incontinence when they're older is because a lot of older women, they have not so good lungs, you know, they tend to cough more. They always feel irritated on their throat because it's dry, then they cough more, and because they cough more, that is why they also leak urine more, so they have more of this incontinence problem as they grow older. Of course, if you solve the cough, then you don't leak, but sometimes it's also not so easy because of their age. They tend to have a bit of cough on and off. It just keeps coming. They don't have to fall sick to cough. So as a result, incontinence is a problem, and we really do not want them to wear Pampers, right? And sometimes if you realize when you were a little child, you know, when you are like 6, 7 years old, you know, when you hug your grandma, your face is like on her lower tummy, right? If you remember, sometimes we do actually smell urine. We actually smell urine in a lot of old ladies when they are in our grandmothers, when we hug our grandmother. So how to prevent this thing? Let's say at any point in your life when you are younger, maybe when you're pregnant, when you're pregnant you get this urine leak, or when after give birth you have urine leak. Maybe after that you're fine, you know, after like 6 months, 1 year after your baby is born, you are back to normal, or you have always been having a bit of urine leak on and off. So what you need to do is you need to do Kegel exercise, and you not just need to do Kegel exercise for that time, but you need to do Kegel exercise for the rest of your life. Because as I mentioned earlier, at the age of 70, I can't teach you Kegel effectively anymore if you already lost all your muscle bulk. So you need to maintain the muscle bulk from young age, you know, from young age you need to maintain. So if you keep doing Kegel exercise, then your muscle bulk will be maintained. Then only if you're at 70 or 80, even if you have some amount of leak, we can still build it up. It's a lot easier if you have some muscle bulk to train you all over again. You know, it's like a lot of old people, so you tend to see them, they hardly go out, they hardly walk. Now you ask them to walk, they feel so weak, right? But if you look at another old lady that is always walking every morning, go out morning walk, or still climbing up the hill, down the hill, up the stairs, down the stairs, 70, 80 also no problem. Okay, so 70, 80 also they can still do everything, 90 also they can still do everything, because they've been training their muscle all along. That's why a lot of us have a wrong concept. It's like when you see your grandmother, you pity your grandmother. You help your grandmother to carry the bag. Actually, you shouldn't help your grandmother carry the bag. You should let your grandmother carry the bag. Why? Because when your grandmother carry the bag herself, then she continue to lift heavy things. Then her muscle, she doesn't lose her muscle bulk. Because if you allow her to lose her muscle bulk, one day if she's going to fall down, she can't even hold on. Because she can't even hold on, there's no strength for her to even hold on to hold to the wall or to hold on to the floor. You know, that her hand got no muscle strength, and that's why they always fall badly. Oh, people fall badly, and the reason why they fall badly is because of their muscle bulk. They lost muscle bulk because they stopped lifting heavy things, because all of us are so kind to help them. So don't help old people carry heavy things. Let them carry heavy things. They have to continue to carry heavy things. They have to continue to climb stairs. Then only their muscle bulk will still be maintained. So same with urine incontinence. You need to do Kegel exercise all your life, so that you can still maintain your urine, prevent your urine from leaking when you grow old. Okay? But let's say you have not done it. All your life you have not done it. That's common, typical. 99% of women never do Kegel all their life. It's either they do for a short period of time during pregnancy, during childbirth, but they never do for the rest of their life. So 99% of women will not do Kegel exercise. So when at 60, 70, they start leaking urine, it is not easy for us to train them back. It's not easy. And as a result, if you cannot train, then the other surgery, the other option you have is only surgery. But surgery, not too bad. Urine leak is one of the simplest surgery in the world. I like to put it in a very simple term. People always ask me, how do you do the surgery? I say I put a very small cut below, just below your outlet of your urine. The cut can be just 1 centimeter, which is very, very tiny. And then I put in a ribbon, like a ribbon. It's a long ribbon-like thing. Go in and tighten it. That's how I do. And then I stitch back. Just 1-2 stitch only, because it's only 1 centimeter the cut. Simple procedure. You don't feel much pain or anything after that. You can have a normal life immediately after the surgery. So it is a very simple surgery, and some people don't even need to stay overnight in the hospital. After the procedure, you get up, you go to the toilet, you can pass urine, you can go home. Okay, so it's a very, very, very simple procedure that you can do, and that is the option. So urine leak, 2 options. One is Kegel exercise. The other is to do a simple surgery for urine leak. And this surgery, honestly, can be done whatever age, 70, 80, 90 also can do, is because we not necessarily need to put you under major anesthesia. It's not a major surgery, it's a minor surgery. I can also don't need to put you under any anesthesia. That means I can just give you some injection to numb your private part, just numb it, and then I put in the sling. So it is a very safe surgery and very simple surgery, and can be done even at whatever age group. Okay, so this will be for urine leak. Then we come to prolapse. So why prolapse and menopause? Same reason, because back to the same reason. We just now say urine leak is because the muscle around the outlet of the urine is loose, weak and loose. So the same, the muscle around the uterus and vagina can also become weak and loose with age. So that is why more women that have already menopause have this prolapse problem. So most of us may have some prolapse when we are younger, after childbirth a bit, but it goes away, it comes, it goes away, it comes. After a hectic day of lifting a lot of things when you're shifting house and things like that, so you may have it a bit, and then after a while you rest, it goes away. It comes and go, comes and go. But again, once you're in your 40s, when the hormones start to change, and also in your 50s, when you actually menopause, this thing actually worsen. And once again, you're going to have, it will worsen as you grow older. So then, what are the things we can do? Same, back to Kegel exercise. But Kegel exercise, you must understand, for urine is the anterior, the front part, the front muscle. Uterus is the middle muscle. So we have front, middle, and back. So we can also have a prolapse of our anus, and also we call the anus, the bowel prolapsing out other than the uterus. So that one is the back compartment. So that's why sometimes it's very difficult to teach you Kegel. Some people say, oh, I can learn Kegel. I just look at the YouTube and I learn Kegel. You can't really learn Kegel in YouTube, because I can tell you what to do, but are you activating the right muscle? Are you activating the right muscle? Is it the front muscle, the middle muscle, the back muscle? So it's not going to be so easy. And are you activating it strong enough? There's strength one, whether it's you have reached level 1, level 2, level 3, level 4, you know, how strong has your muscle achieved? And all these things is very hard for you to assess. That's why Kegel exercise need to learn from professionals. Who are the professionals who teach Kegel exercise? They are physiotherapists who specialize in women's health. So physiotherapists got all sorts one, okay? There's some who specialize in hands, some who specialize in leg, some specialize in stroke, some specialize in different things, chest, you know, all the breathing problems. So you need to look for physiotherapists that specialize in women's health. So when you look for physiotherapists that specialize in women's health, these are the professional people who do nothing but taking care of women's problem related with physiotherapy. Okay, so when you don't know where to find one, I have one in my clinic. So if you are my regular patients, then you can always just make an appointment to see my physiotherapist. Okay, so Kegel is one thing, and it's the same story. If you have been doing Kegel all your life, then of course you can still continue to do Kegel, and it can still be equally effective irrespective of your age. 50, 60, 70, 80, still good one. But if you have not been doing Kegel all your life, then to start doing Kegel at a very, very late age is sometimes going to be difficult. So if Kegel fails, some people, they can do Kegel when they were younger. When they grow older, it's just difficult. It's also because the urine leak or even the prolapse worsen with age. That is the key word, worsen with age. So whatever you do, they will reach a stage where it will worsen, and Kegel may not help anymore. And that is why they will opt for surgery. And for prolapse surgery, there's tons of prolapse surgery out there. So many. Urine leak also got other surgery, but the older surgeries have already sort of gone out of fashion, because ever since we have this little ribbon that can tighten everything, others just gone out of fashion already, because I don't need to do any major surgery anymore to solve your urine leak problem. But for prolapse, it's different. Prolapse surgery, there are so many out there, and still a lot are very, very commonly done. Partly it's because we do not have a simple surgery that solves all problems. So they wanted to do the same thing, like the ribbon thing for the prolapse. Unfortunately, it was popular at one time, but came back with a lot of complication, and it has been banned. Nobody does it anymore. So no simple surgery that is simple and effective. There isn't any simple and effective, except for one which I'm going to mention later. So for prolapse surgery, there are many different types. There are prolapse surgery that push up. Okay, before I talk about surgery, actually I missed out one thing. Other than surgery, there is actually something you can wear inside your vagina. You wear inside your vagina to push the uterus up. Long ago, I still know some old ladies still doing, maybe about 10 years back. What they do, this is a traditional way. what they do, they just stuff cloth inside, you know, they stuff cloth inside, just stuff cloth inside to push the uterus up, you know. So sad, because every time you stuff the cloth inside and pull it out, actually it can be quite painful. And then when they need to pull it out, right, because it's going to go dirty and smelly, and then if you take it out, the whole uterus just come out. Because in prolapse of uterus, you can have the entire uterus outside, you know. So you can imagine you have one big chunk of thing in between your legs. It's quite a difficult thing to endure, especially if you have to walk out of the house. So those days, a lot of old ladies, I know, they don't go out of the house so much. So when they're at home, they don't care, they don't walk much, they just leave that uterus outside. But when they want to go out, then they would stuff cloth inside, or even stuff, you know, pad, you know, they put the entire pad inside to I don't know whether you can imagine the pad so big and yeah, can go in. So it go in, because when it prolapse, it's just so loose, so they can actually stuff the whole pad inside, and then they can go outing, you know. So quite sad, that's how they do it. But medically, we have something. We have this plastics that you can actually wear and push the whole uterus out. But the only disadvantage is you need to wear for the rest of your life, isn't it? So it's going to get dirty, and as you grow older, every time you take out, take in, also it can bleed, it can hurt. Although it is no surgery lah, no surgery, but it is not going to be so convenient. In fact, to me, I don't quite, I'm not a strong supporter of that, is because I know you can do it when you're 50 and 60, but when you're 70 and 80, who's going to take it out, put it in, clean it, you know? If you can do it yourself at 70 and 80, okay, but it's not going to be that easy unless you have a daughter who's willing to do for you, a daughter-in-law who is willing to do for you. I have a few old ladies that I have put a pessary, and they're fine because their daughters or their daughter-in-law is willing to take it out for them, clean it for them, put it back in for them. But honestly, how many of us are actually staying with our daughters in the first place, and how many of us, our daughters, are willing to do these type of things? Not many. So it can be quite troublesome. You can do it when you're in your 50s. Even in 50s also, I tell you, there are a lot of women who say, I'm not there to do this. Even for herself, they're not there to do. So what more other people do for you, okay? So wearing this ring pessary, we call it ring pessary, is effective, but may not be practical for the rest of your life. You must also understand, even if some of them will say, I'll go to the clinic and get the doctor to clean. Yes, you can always come to the clinic, but there's also one problem. Until what age can you come to the clinic? Have you thought of that? Sometimes you need to think about that. Maybe you can do it now, but you can't do it when you're 80 or 90. Maybe you can't walk. Then you can't come to clinic. Then how? I still remember long ago, I used to do house calls those days, and then I'll go to the house and change. But it's not so simple. And how many gynaes actually do house calls? Very hard to find. So as a result, it is a problem. It can be a problem. And at that time, when you cannot walk to see a gynae to take it, are you still fit to do a surgery to solve your problem? May also be a problem already. So it's better do a surgery when young. This is my advice. You know you have prolapse, you better do it when you're young and fit, okay? But having said that, when you do it when you're young and fit, it is also very important to choose the right surgery, because there are two types, in fact it's three types of surgery. One is we push the uterus up, push up. One is push up, one is pull up. Okay, so you have push up, you have pull up, and third, we close the hole. Close the hole, settle once and for all. Close the hole, your uterus will never come out, but you only sacrifice one thing: no more sexual intercourse. Not a problem to a lot of very old ladies. Closing the hole is something I do usually to very old ladies. When they are very old, most of the time, we don't want to do any big surgery. We just stitch up the hole, need a small surgery. And just like the surgery I mentioned earlier, for the urine leak, simple surgery, no need major anesthesia. You can even do it just by numbing your private part, and I just stitch it up. And after that, you pass urine and you can go home. So simple, okay? So I keep that for very old lady, because they have no intercourse, no problem, okay? But sometimes you cannot underestimate old lady. I have one 80-over-year-old old lady who refused to do the surgery because I say no intercourse. After that, then she refused to do already. 80-over-year-old. So some old ladies can be still very sexually active, so they won't do that surgery. But many old ladies actually willing to do this surgery. Then so if you are older, then we will choose the surgery just to close up the hole and solve the problem once and for all. But if you are younger, then you have an option between push and pull. Many people like push is because I do the surgery from below. I do the surgery from below, so it always looks like a much simpler surgery, less complication. True. But we know that pushing up doesn't last forever because, as I mentioned, prolapse worsen with age. Worsen as you grow older. I push it now, maybe 5 to 10 years, it come out again. So then you're going to do another surgery. So you keep doing surgery if you do the surgery that push up. So the other surgery that is more ideal, that is permanent, is pull up. Pull up, it is a much bigger surgery because now we need to go in through the tummy. But good news is nowadays we seldom do big surgery. We do keyhole surgery lor. Just 2-3 small holes in your tummy. I go inside, I pull up the whole uterus and stitch it to somewhere else higher up so that it has no way to go down again. So this is how we solve the prolapse by doing surgery. So if you're younger, it's better to do a surgery that pull up. Number one, it is permanent. Number two, you can still have intercourse, no issue. But if you are older, if you're very, very old, you cannot do this surgery because it is a much major surgery. You need to be on full anesthesia. And if you are already like 70, 80 with multiple problems, with multiple health issue, and you worry about surgery, then you just close up the hole lah. Close up the hole, tell your husband bye-bye. No more sexual intercourse, close up the hole, and no more intercourse. But this problem solved once and for all. Because once closed, there will be no more prolapse already. Okay? So, yeah. So that's all I have to say about urine incontinence and prolapse for menopause. So if you have any questions, I realize that many of you are maybe still very young. But anyway, it's good to know. It helps you get some knowledge. For one day, every one of us will menopause and every one of us will grow old. So we will have to face incontinence and prolapse, many of us eventually. Especially if we already have some incontinence or some prolapse even now before you menopause. If you have it, then when you grow older, it is bound to come. Okay? So if you have any questions, please put it up in the comment section. And as usual, if you have missed any of my previous videos, go to my YouTube channel, Dr. Tan City Clinic, and look for uterus prolapse and urine incontinence. Previously, I gave the talk more towards younger women because there was a request for uterus prolapse after birth and urine incontinence after birth. So that one is more tailored towards women who are young after birth. Today's topic is more towards menopause, but there is a lot of overlap. Okay, if you have any other questions that you want me to talk about, please put in the comment section as well. And before I go through your questions, just to let you know, next week is one last topic on menopause, and I'm going to cover menopause related sexual issues, which is actually a very big thing because a lot of women have problems having sex after they menopause, but they do not know who to look for, how to solve their problem, and they're very shy to even ask. Sometimes even when they see me, they ask questions like 2-3 words, never get straight to the point. No, women are very shy to ask about sexual issues. So maybe it's good to share the video next week with all your relatives and friends because people don't talk about it. So it's better to just share. And after that, I will be doing one whole series on endometriosis. Endometriosis is the topic, my favorite topic nowadays, and I see endometriosis every day. So I would focus more on endometriosis for a couple of weeks. Okay, Fatin has a question. She say, I have incontinence, urine incontinence when I first have sex at the age of 30. It took me almost a year to become better. Okay, if you, Fatin, you should go and look back at my video on urine incontinence. Because urine incontinence per se, there are many types of urine incontinence. Not all urine incontinence is due to the muscle weakness or the muscle loosening. So there are many other reasons for incontinence. When you have incontinence during sex, especially when you're so young, it has nothing to do with this stress incontinence, which is the incontinence due to loosening or weakness of the muscles in your pelvis. So not a problem, so nothing related. So it doesn't mean that you have this incontinence, you're more likely to get incontinence when you're older. No, nothing to do with that. So don't worry, okay? Okay, it looks like there aren't any more questions. So today's topic is short and simple, but do share this topic, okay? Especially to the people who have already menopause or much older women. Do share with them, because another thing about women, when it comes to incontinence especially, a lot of women just take it as normal and live with it one. So please share so that people know that they can do something about it, okay? And if you want a really good women health physiotherapist, I have one in my clinic, which you can make appointment to see her directly. Okay, so that's all for today. Do stay tuned next week, same day, same time, yeah? Okay, thank you and bye-bye.